In my decades as a cardiologist, I've pronounced too many deaths that could have been prevented. The patient felt fine that morning, played with their grandchildren, tended the garden, no chest pain, no warning. Dead by noon. Cardiovascular disease claims nearly 1 million lives in the United States every year. And here's the sobering truth. If you're over 60, your risk increases dramatically. But what keeps me up at night is that their bodies were sending distress signals for weeks, months, even years before the fatal event. They just dismissed them as normal aging. Today, I'm going to show you the 9 warning signs that could save your life. Signs your body is screaming at you right now, but you're mistaking for getting older. And if you have elderly parents or loved ones, share this video with them immediately. It could be the most important thing you do today. Sign number 1. Chest pressure. Chest discomfort is your heart's distress signal, and it's particularly dangerous for seniors because it often presents differently than in younger people. When plaque, a mix of fat, cholesterol, and calcium, builds up in your arteries over decades, it creates a traffic jam. Your heart muscle isn't getting enough oxygen-rich blood. This creates what we call ischemia. You'll feel pressure, squeezing, or burning that may spread to your shoulders, arms, neck, or jaw. It gets worse with activity, walking to the mailbox, climbing stairs, even getting dressed, because your heart demands more oxygen, but the narrowed arteries can't deliver it. Some describe it as an elephant sitting on their chest, and others feel a tight band around their rib cage. Here's the dangerous part for older adults. Many dismiss it as indigestion, arthritis, or just old age because of where it's located. But unlike heartburn, this doesn't respond to antacids and follows a pattern, appearing with exertion, easing with rest. If the plaque ruptures and forms a clot, that clot can completely block the artery. You're having a heart attack. Heart tissue is dying. Every minute counts, and seniors have less cardiac reserve to survive this. Sign number 2, breathlessness. When you're short of breath from simple activities you used to handle easily, activities you've done your whole life, your arteries are likely blocked. Maybe you can't walk across the parking lot without stopping, or you're winded after making the bed. This isn't just getting older. Your heart can't pump enough oxygen-rich blood to meet your body's demands. For seniors, this is especially critical because breathlessness often develops so gradually that you unconsciously adjust your lifestyle around it. You stop going upstairs, you avoid walking long distances, you tell yourself you're just slowing down. But that gradual decline is your heart crying for help. In severe cases, breathlessness occurs even at rest or when lying down. Many of my older patients wake up gasping for air at 2 or 3 a.m., needing to prop themselves up with 3 or 4 pillows just to breathe. This means your heart is struggling to supply blood to vital organs under normal conditions. This is an emergency waiting to happen. Sign number 3, persistent exhaustion. This isn't the normal tiredness that comes with age. It's bone-deep exhaustion that rest doesn't fix. When your arteries are blocked, your organs and muscles can't get the oxygen and nutrients they need to function properly. Your body enters energy conservation mode, prioritizing vital organs while starving everything else. You'll feel drained even after sleeping well, struggling through simple daily tasks. Your brain feels foggy, your muscles feel heavy, and even getting up from your favorite chair feels like climbing a mountain. For seniors, this is particularly insidious because everyone, including doctors sometimes, attributes it to aging. You might hear, "Well, you're 70, what do you expect?" But I'm here to tell you, severe persistent fatigue is not a normal part of aging. Unlike typical fatigue, it worsens over time if the blockages remain untreated. I've had patients in their 60s and 70s tell me they thought they were just getting old or doing too much. They waited years before seeking help, and by then, the damage was extensive. If you have chronic fatigue without an apparent cause, restricted blood flow might be slowly killing you. Don't accept this as just getting older. Sign number 4, leg pain when walking. Leg pain or cramping during walking is called claudication, a sign of peripheral artery disease. The arteries in your legs are blocked, limiting oxygen to your leg muscles. This is extremely common in seniors, especially those with diabetes or a history of smoking. You might notice your calves ache after walking a block, or your thighs feel heavy when you climb stairs. The pain typically goes away after a few minutes of rest, which is the telltale sign. Many of my older patients tell me they just thought their legs were giving out with age. The pain location reveals where the blockage is. Calf pain suggests lower leg blockages, while thigh or buttock pain indicates larger arteries higher up. Here's the critical point for seniors. If you have blocked arteries in your legs, you almost certainly have them elsewhere, including your heart and brain. This isn't just a leg problem, it's a whole body cardiovascular crisis that puts you at high risk for heart attack and stroke. If this sounds like you, subscribe now so you don't miss our upcoming video on preventing arterial disease and protecting your independence in your golden years. Sign number 5, nausea and cold sweats. Sudden nausea and sweating, especially with chest discomfort, means your heart is under severe stress. And this is particularly important for older adults to understand because women and seniors often experience heart attacks differently than younger men. When blood flow to your heart drops, your brain activates the fight or flight response, releasing adrenaline that causes cold sweats. You might feel clammy, dizzy, or like you have the flu suddenly. Meanwhile, blood diverts away from digestion to prioritize vital organs, creating nausea. Too many seniors dismiss this as food poisoning, stomach bug, or medication side effects. I've had patients who went to bed thinking they had indigestion, and their spouse found them dead in the morning. When nausea and sweating occur with chest pain, breathlessness, or unusual fatigue, it's your body screaming for help. Call 911 immediately. Don't wait, don't see if it passes, and don't worry about being embarrassed if it's nothing. I'd rather you have a false alarm than a fatal delay. Sign number 6, heart palpitations. When your heart feels like it's racing, pounding, or skipping beats, it's working overtime to pump blood through narrowed arteries. For seniors, this is particularly concerning because aging hearts have less ability to compensate for stress. The oxygen shortage causes irregular heartbeat as your heart struggles to circulate blood effectively. You might feel fluttering in your chest, a sensation that your heart stopped and started, or like your heart is beating in your throat. Occasional palpitations from caffeine or stress are normal, but persistent palpitations, especially with chest pain, breathlessness, or dizziness, indicate serious cardiovascular problems. Seniors who ignore this, thinking it's just heart flutters or skipped beats, often face deadly complications like stroke or sudden cardiac arrest. If you're on medications, and many seniors are on multiple medications, palpitations can also indicate dangerous drug interactions that affect your heart rhythm. Sign number 7, high blood pressure. High blood pressure is the silent killer, causing damage for years without symptoms. And if you're over 60, you're in the highest risk category. When arteries narrow from decades of plaque buildup, your heart must pump harder, elevating blood pressure and straining both your heart and arterial walls. Over time, this forces your heart muscle to thicken, especially the left ventricle. This thickening, called left ventricular hypertrophy, reduces your heart's efficiency and dramatically increases your risk of heart failure, a leading cause of hospitalization in seniors. High blood pressure also damages blood vessel linings, making them more susceptible to plaque buildup, a vicious cycle that worsens blockages. Many don't realize they have it until they experience heart attack, stroke, or kidney damage. I've seen patients in their 70s with blood pressure damage so severe they need dialysis. The good news? Blood pressure is one of the easiest things to monitor and treat. Get your blood pressure checked regularly, at least every doctor's visit.
If you have diabetes, kidney disease, or heart disease, check it even more frequently. Many seniors benefit from home blood pressure monitors. Even slight blood pressure reductions significantly lower the risk of deadly complications and help you maintain your independence longer.
Sign number 8, leg or feet swelling. Swelling in your legs and ankles or feet, called edema, signals your heart is struggling. This is incredibly common in seniors, but should never be dismissed as just part of aging. When arteries are blocked, your heart can't pump efficiently. Blood pools in your lower extremities, where gravity works against you. This increases pressure in blood vessels, pushing fluid into surrounding tissues. You might notice your shoes don't fit by the end of the day, or sock marks stay indented on your legs for hours. Your ankles might disappear, or pressing on your shin leaves a dent that doesn't bounce back. Sudden or worsening swelling is especially concerning. It means blood flow issues are becoming severe. This can also indicate heart failure, where your heart simply can't keep up with your body's demands anymore. Too many seniors dismiss this as water retention or blame it on sitting too long, but when it's persistent or worsening, your heart is failing to meet your body's demands. Combined with breathlessness, this is a sign of advancing heart failure that requires immediate medical attention. Sign number 9, cold, discolored hands or feet. When your extremities appear pale, bluish, or feel cold, even in warm conditions, less oxygen is reaching them. Many seniors notice their hands and feet are always cold, or their fingers turn white or blue. They might blame poor circulation or Raynaud's disease. Your body prioritizes blood flow to vital organs over hands and feet when circulation is compromised. This is often an early sign of peripheral artery disease, signaling widespread atherosclerosis affecting multiple blood vessels throughout your body. In my practice, elderly patients with cold, discolored extremities usually have more extensive arterial disease than they realize. This puts them at extremely high risk for heart attack, stroke, and even amputation if blood flow becomes critically reduced. If you have diabetes, this is doubly dangerous because you may have reduced sensation in your feet and not notice injuries that can become infected. These 9 signs are your body's emergency broadcast system. Each one reflects reduced blood flow and oxygen delivery due to blocked arteries. And for seniors, each one represents a threat not just to your life, but to your independence, your ability to enjoy your grandchildren, travel, and live the retirement you've earned. Here's what I've learned in 30 years. The patients who thrive in their later years are those who pay attention to their bodies, don't accept it's just your age as an answer, and seek help early. If you're experiencing any of these symptoms, don't wait. Don't be stoic. Don't worry about bothering your doctor. Contact a healthcare provider immediately. Early intervention is the difference between life and death, between independence and disability. Your generation was raised to be tough, to push through discomfort. But when it comes to your heart, that mindset can kill you. It's not a weakness to seek help, it's wisdom. If this video could save someone's life, a parent, a spouse, a friend, share it with them right now. Like, subscribe, and remember, your body is always communicating with you. The question is, are you listening? This is Dr. Marcus Chen. Take care of your heart, because it's been taking care of you your entire life, and it deserves your attention now more than ever.